rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello, everyone. Today, I saw a patient with essential thrombocythemia, and an important management question came up. She has never experienced a thrombotic event, remains active, and is just under 60 years old. However, her molecular testing is positive for the JAK2 V617F mutation. So, is she truly a low-risk patient, or does her mutation place her at a clinically meaningful risk of thrombosis? Let's use the IPSET-Thrombosis Calculator to assess the case. Our patient is a 59-year-old woman with confirmed essential thrombocythemia. She has no previous history of arterial or venous thrombosis. Testing is positive for the JAK2 V617F mutation. She does not have diabetes or hypertension, does not smoke, and has no other significant cardiovascular risk factors. Let's enter her information into the calculator. We'll begin with age. The calculator asks whether the patient is older than 60. She is 59, so we'll select no. Next is history of thrombosis. She has never had a previous thrombotic event, so we'll select no. Now we'll enter the JAK2 V617F mutation status. Her result is positive, so we'll select yes. This contributes 2 points to the total score. Finally, we'll assess cardiovascular risk factors, including diabetes, hypertension, and smoking. None are present, so we'll select no. Everything has been entered. Now let's calculate the score. Here are the results. The patient's total IPSET thrombosis score is 2, placing her in the intermediate risk group. The reference data associates this category with an estimated thrombosis risk of approximately 2.86% per year. This result can support discussion about antiplatelet therapy and cardiovascular risk management, but it should not be used alone to prescribe treatment. The clinical summary provides a clear overview of the final risk category and the patient factors that contributed to the score. To see exactly how the result was calculated, we can also review the calculator logic. The original IPSET score assigns 1 point for age over 60, 2 points for previous thrombosis, 2 points for JAK2 V617F positivity, and 1 point for cardiovascular risk factors. In this case, the patient receives 2 points from her JAK2 mutation, while the other 3 criteria contribute no additional points. If you need to use the assessment elsewhere, select Copy to copy the result as plain text and paste it into your own clinical document. You can also enter a patient name and save the assessment within the platform. Once saved, the case will appear in the Saved Results panel on the right-hand side, where previous assessments can be reviewed. If we scroll down, the reference data shows the estimated annual thrombosis risk associated with each score category. A score of 0 is classified as very low risk. A score of 1 is low risk. A score of 2 is intermediate risk. And a score of 3 or more is classified as high risk. It is also important to remember that the original IPSET score and the revised IPSET framework use slightly different risk language. Treatment decisions should therefore also consider bleeding risk, platelet count, acquired von Willebrand syndrome, comorbidities, and current hematology guidelines. If you found this case helpful, please like and subscribe for more oncology and hematology decision support tutorials. Thanks for watching, and I'll see you in the next clinical case.